So I'm going to be talking on the new technology from Alcon. So the title of the talk is Being Close with Active Sentry. So in terms of fluidics in phacoemulsification, there has been a gradual evolution more in the recent past. So we were all comfortable with the gravity fluidics. So those of us who needed more fluidics, we also had the hyperpressurized bottles. More recently, we have had the fortune of using active fluidics, which basically uses compression plates to maintain the surgeon selected target intraocular pressure. And again, we now have the active sentry, which also works well with the active fluidics. So in terms of the active fluidics, basically it differs from the gravity fluidics in that the bag goes into the bay behind the machine and the bag is compressed by two plates, and this helps to balance the inflow and the outflow. So this also helps greatly in the anterior chamber stability during surgery. So this is available today with the Centurion phaco system. In addition to this, we now have the active sentry. So this is a case which is being done with the Centurion system without the active sentry. If you note, my target intraocular pressure here is 60. So this active fluidics permits the surgeon to have a target IOP, and the machine strives to have the IOP around that setting. And this is the big step forward from the gravity fluidics, because we saw better patient comfort during the phaco procedure and chamber stability as well. So we also today have an advantage of having higher settings when we're using this technology. So this is a mature cataract. And though the IOP is set at 60, we would also have to additionally set in a parameter for the leakage compensation as well when it came to using the Centurion machine before the active sentry. I'm not sure why the video is...
I think we're not able to hear you.
Oh, you're not able to hear me?
Yeah, now it's okay. Please go ahead.
Are you able to see it now? And
Yes.
yeah,
Please go
okay.
ahead.
Yeah, so this is a case like did you not hear anything I said so far, or is it just for this video?
No, please carry on. Please carry on. Just a few words.
Okay. Yeah, so this is, like I said, the using of the Centurion machine without the active sentry in a white cataract, where chamber stability is very, very, very important because we don't have the epinuclear support in these white cataracts. So the CDE here is again lesser because of the help of the technology, which permits you to have higher vacuum and a flow rate. So today we now have the Active Sentry as a new technology available. So I have been working with the R&D team on this technology for the last 4 years before it was introduced in the market. And I saw an advantage. It definitely added to my comfort and enhanced the patient safety factor as well. Now this Active Sentry, the difference is that the handpiece feels almost similar to the existing handpiece, but the difference is that there is a pressure sensor within the handpiece. And now that it is close to the eye, the IOP is now, it's closer to what it was preset at. This Active Sentry also communicates well with the Centurion fluidic system, and this also helps us to have a better chamber stability. The other difference in this technology is the aspect of having the QuickValve technology, and this helps in real-time occlusion, break surge reduction. So this is one additional factor with this. And with the addition of the active sentry on the active fluidics, the fluctuation in the anterior chamber is also greatly reduced. This fluctuation is reduced because of two major differences which we see with the active sentry. The first is that the machine now automatically censors the patient eye level. So one would not have to set it at, like, say, a +5 or -5, etc. So this is something which has now been removed. The second thing is the machine also compensates for the average incision leakage. So this is a big advantage because one can now set the IOP to be much lower, or can also have higher vacuum and flow rates for your more harder, more difficult cases. So this is a immature cataract, slightly on the harder side with the active sentry. So the IOP here is set at 40. So a similar grade before the Active Sentry, my standard IOP would be 60 with about 20 leakage compensation, which would mean more than 60 in actual surgery. So here when I have a lower IOP, it means so much more comfort for the patient. While I reduce my IOP, I still can use the same aspiration and vacuum settings, which is 32 and 475 for these immature cataracts. So with the sensor in the handpiece, the detection of this pressure is also real time. So there is much better response and the chance of having surge is also greatly reduced. This is a mature cataract. So as I said earlier, in mature cataracts, we need to have a higher safety component because we don't have the epinuclear support. Again, my IOP is set at 40 with a similar vacuum and aspiration flow rate settings. Very important to have chamber stability in these cases. There's a higher chance of PC trampolining during the emulsification, but during the chop as well, it is more difficult for us to have control during the chop phase as well. So you want to have a very stable anti-chamber here. The torsion is at 60 using the Ozel technology. I do not use any longitudinal phaco, but the one which has kicked in is because of the Ozel IP, which kicks in when I use about 90% vacuum. So like I mentioned earlier, because of the leakage compensation, the IOP is said to be lower and the vacuum and flow rate is still the same. So there's actually no difference from what I was doing earlier. So I have the same comfort, which means there is actually hardly any learning curve involved while giving a safer atmosphere and better comfort to the patient. The third and the last case is a hard cataract. So as we know, with hard lenses, one would like to use higher vacuum and flow rate. I'm using about 600 vacuum here. With the active sentry, that is one big advantage. If someone does not really, is not keen to reduce your IOP, for instance, one can just choose to have an IOP of, the same level, but have a much higher vacuum. So you can have about 30% more vacuum compared to your older settings before you use the active sentry. So with the higher settings, and again, a very comfortable IOP at 45, there is a very good chamber stability with this machine. The other aspect is that what I missed to show in the previous case is the number of times the active sentry kicks in. So the ASM is also shown on the metric screen end of the surgery, and it kind of gives us an idea as to how many times the active sentry was actually used during your procedure. And for example, it was about 2 times in the previous case, which means that the chance of surge was prevented in at least twice in that one case. So it just makes surgery a lot more safer for the surgeon when this technology is being used. So in cataracts like this, I think one knows the advantage of having a higher vacuum because that way your CD also tends to reduce. So when you have higher vacuum and you have better holding capacity during your phaco or during emulsification as well, when you have higher vacuum, you find your overall energy level, which is used or delivered in the eye, significantly is lower, which means clearer cornea on post-op day 1. I also use chondroitin sulfate viscoat in all of these hard cataracts. So this also helps to have a clear cornea on post-op day 1. And I think with the pandemic, many of us have seen many more hard cataracts, mature cataracts in our practice. So I mean, this has kind of become much more common than it was in the past. And it's now part of a routine case now. It is when you have better technology at your disposal, it makes your procedure that much more easier to perform. I think for some reason the video is not playing up to the very end, but this just probably just shows that the CD as well in this case was about 15, which is again quite acceptable for a cataract of this density. So in conclusion, the Centurion machine with the Active Sentry Handpiece enhances the phaco safety, consistency, and control. And it does this by reducing surge, by detecting pressure and providing precise adjustments to ensure consistency. It also helps to maintain the target IOP regardless of the PEL, because this is automatically set by the machine. And it also, you can work with different kinds of cataracts. For example, if you want to work on a lens subluxation with very low vacuum, this is the good technology to use. Also for cases with very hard cataracts where you need very high vacuum, this works well as well.